Ambient air pollution has numerous well-documented health effects, ranging from discomfort to chronic condition and even premature death. Short-term and long-term exposure have been associated with detrimental health effects. The OECD has estimated the cost of premature death due to particulate matter to $5.1 trillion US dollar in 2015. And this estimate doesn't even take into account a large range of pollutant or health outcomes. Furthermore, the OECD expects that this cost will increase tenfold by 2060. And who is paying the cost? Well, very often it is still not the polluter, for at least one reason. The price of pollution is not fully integrated into his decision process. Take the example of single-use plastic bag. We all knew they had detrimental environmental effect, but many of us had to wait to be effectively charged for them in order to adopt the reusable carrying bag. So what happened when we take a decision? In a classical decision-making and a classical economic evaluation setting, we take into account the financial cost of two alternatives and the health benefits. And we choose the alternative that provides the greatest value for money. If pollution doesn't have a price, we simply don't account for it in our decision process. What this means more broadly is then when we have to decide to purchase a good, or for example, making an investment decision, and this affects the level of pollution, either as an increase or as a decrease, which represent a cost or a benefit, if there is no value for pollution that we can integrate into our decision making, we simply assume that the cost of pollution is zero, and this is no longer acceptable. It doesn't have to be like this. Take the example of a healthcare provider, which has to decide between providing a treatment at home versus at hospital. The classical thought process is to take into account financial costs and health benefits. Well, we show that we can simply account for carbon emission by taking into account carbon footprint costs. This was a relatively straightforward exercise because carbon can be taken into account as its global effect. Whereas when we want to take into account pollution, we have to take into account where it is emitted and the current level of pollution. So this is a much more challenging task, but not impossible. And this is what we've done at Imperial College. We joined forces with UK Health Forum. We were supported by Public Health England, and we built a truly interdisciplinary team combining public health experts, microsimulation modelers, economists, and pollution modelers. And we developed a model that allowed us to estimate local impact of pollution. So we consider small particulate matter, nitrogen dioxide, 7 health outcomes, for example, lung cancer or respiratory disease. We consider pollution long-term exposures, and on the cost side, we looked at National Health Service and social care service costs. Our model allows us to simulate different pollution levels now and in the future and calculate the associated cost of this increase or decrease in pollution. For example, we estimated that a region that has a high pollution level compared to a region with lower pollution level could make savings that are 16 times larger by meeting the European limits of nitrogen dioxide. These type of results support priority setting and budget planning. But the true contribution of this project was the development of a tool that allows each local authority in England to input a change in pollution for any project. So if it increases or decreases pollution, they can input this value and get the associated cost that can be a saving or an increased cost for the health service. This local estimate of pollution are key elements to be taken into account into the decision-making process. It allows us, for a given health benefit, to choose alternatives that provide a lower level of pollution. Our methodology can be expanded to different geographies, and we can account for different health outcomes as well as different pollutants. We can take into account different local pollution levels, but this complex analysis requires more data and more evidence on the impact of pollution on health outcomes. However, if we want to put systematically a price on pollution, we will have to make some simplifying assumptions. But this allows broader integration of accounting for pollution and allow us to shift the burden of pollution to the emitters. Economic evaluation are perfectly fitted to integrate the price of pollution or other market instruments. But it is only when we have a full price that incorporates all the damage of pollution that we can make decisions that are socially and environmentally sustainable. Thank you.